stories around the world to stories here at home. This is the National News Broadcast. A pleasant evening. I'm Nilanjali Ananda.
Good evening. I'm Lakshit Singha, and to start off, we take a quick look at the top stories.
The Met Department forecast that the atmospheric low-pressure system in the vicinity of the island is developing into a depression. An enhancement in the prevailing showery condition with roughness at sea is forecast. Health authorities caution a risk in the rise of dengue. Lockdown ends in all areas placed in isolation due to the spread of the coronavirus. Attempts to sell 225 kilos of heroin under the pretext of selling rice with the essential services label revealed. The state Poson festival to be held at the Mihintale sacred site in Anuradhapura. The global economy predicted to suffer a loss of $8.8 trillion due to the COVID-19 spread. The Director General of the World Trade Organization resigns.
On to those and other stories in detail. The Met Department states the low-pressure system in the atmosphere around the southwest Bay of Bengal and the southern Andaman Sea area is developing into a depression. Thereby, an enhancement in the showery conditions, especially in the southwest parts of the island, is forecast within the next few days from today. Rainfall of over 150 millimeters is expected in some areas. Wind speeds over the island can exceed up to 40 to 50 kilometers per hour at times. The Met Department forecasts showers or thunder showers in the southern, western, Sabaragamuwa and central provinces, whilst showers or thunder showers can be expected in the other provinces in the evening or night, especially in the Uva and eastern provinces. Heavy falls of over 100 millimeters of rain can be expected in some places of the western, Sabaragamuwa and central provinces and the Gaul and Matra districts. The general public is advised to take adequate precautions to safeguard against accidents caused by lightning and temporarily localized strong winds. Showers or thunder showers can be expected at times in the sea areas around the island. Heavy falls are forecast in certain sea areas from Colombo to Batiklo, which includes the sea areas of Gaul and Hambantota. Roughness at sea can be expected around the island. The Met Department states the sea areas from Gaul to Potuville can turn rough at times. Wind speeds in these sea areas can increase up to 70 to 80 kilometers per hour during thunder showers. The naval and fishing communities are advised to be vigilant. Meanwhile, as a flood preventive measure, the Navy has taken steps to remove the saltwater blockade placed across the Kalani River in the Ambatale area. This measure will allow the river water to flow to the sea uninterruptedly should the water level rise with the rains. The Navy deployed a group of divers attached to the Western Naval Command for this purpose. Many of the access roads to the Gaul town are inundated due to heavy rains experienced in the area since afternoon. Due to the Moragoda Lake overflowing, the low-lying areas in the Julgaha, Dangedara, Pettigalavatta, Sangamittapura and Abdul Wahab Mawata have been inundated. Our correspondent states the low-lying areas of the Baddegama, Valivitiya, Divitura, Yakkalamulla and Imaduwa areas also went underwater. Meanwhile, 2 persons in the Imaduwa Habaraduwa area who sustained injuries when their house was struck by lightning were admitted to the Karapitiya hospital.
The military and the police and all the staff been standby with the equipment. So in many areas of the country, especially for the southwestern part, which we are expecting some kind of disaster situation as per the Met Department forecast. So 117 call center number is completely open. People are advised to be very vigilant, and so fisheries and naval communities are thoroughly advised not to go to the sea areas. It's very important. So sometimes sea search could also be expected, and it might be 2 to 2.5 meters as per the Met Department. And still the special plan is going on. We have arranged that plan because of the COVID-19 is going around the country, and that will be consisting of the health and all other technical agencies and district secretaries and all the government officials and all the stakeholders, especially the NGOs and INGOs, all been linked with that our process. So it's very important At this moment, safe evacuation, before 24-hour evacuations, center arrangements also been included in this plan. So it's very important. If any queries, people can call via 117 call center number in 3 languages and a 24/7 basis.
Meanwhile, the health authorities caution that a risk of dengue could resurface due to the prevailing wet weather. Therefore, special attention needs to be focused on maintaining a clean environment to control mosquito breeding. Dengue was scientifically discovered in the country in 1962. It is a deadly disease, and Sri Lanka has not been able to eradicate the disease from the country as yet. Annually, around 50,000 persons in the country contract dengue, whilst around 50 dengue-related deaths are reported. 150,049 dengue patients were reported in the country last year. The majority of them were identified in the Colombo district. This year, 19,244 dengue patients have been reported so far. Director General of Health Services Consultant Dr. Anil Jasinghe cautions that due to the prevailing rainy condition, a rise in dengue is feared. He further stated as much as the spread of COVID-19 depends on person-to-person physical contact, dengue depends on man and the environment. Here, Dr. Jasinghe points out that it is the man-made breeding places where fresh water gets collected that facilitate the spread of the Aedes aegypti and Aedes albopictus mosquitoes. Therefore, Dr. Jasinghe advises the public to maintain a clean environment around residencies and office places free of mosquito breeding grounds.
President Gotabaya Rajapaksa says that irrational laws should not obstruct the policies formulated to achieve the economic objectives of the people. The President stresses that state institutions and institutions affiliated to them should not resort to legal action but instead resolve their issues through discussion. The President expressed these views during a discussion with ministry secretaries and officials attached to the plantation sector at the Presidential Secretariat yesterday. Long-rooted legal issues between the State Timber Corporation and the State Plantations Corporation were discussed in depth. At the discussion, it was pointed out that issues prevailing between the affiliated institutions have been taken to court, as such issues were not taken up for discussion. It came to light that the Land Reforms Commission has filed over 800 cases and 300 out of them were against the Plantation Corporation. The President also emphasized the importance of removing plantations that are not suitable to the country or harmful to environmental conservation. He also emphasized the need of planting crops most suitable to the country. The President further states that state institutions should be maintained without burdening the treasury, and it should not take long to present strategies in this regard. President Gotabaya Rajapaksa stressed that when a government takes the right decision with regard to a state policy, all state institutions should comply. President Rajapaksa further emphasized that there should be no room to withhold carrying out the right thing. The President states that a state official who could not execute the right thing is a burden to this nation, as the state official is an individual who resolves issues and does not neglect them. President Gotabaya Rajapaksa pointed out that public sector employees need to be instrumental in the development of the state sector. The President further stated that since the participants at this discussion are fully aware of his policy, it needs to be adhered to, and if an individual does not abide by the policy, such an individual who feels that it is beyond his capacity should resign. The President noted that loss-making institutions can also earn a large profit, and it is for this purpose that the support of public sector employees is needed. The President explained that the issues of the public sector need to be queried and resolved, and that is the right thing that he as the President expects from public sector employees. The President noted that a decision was taken to cease the importation of ethanol, which had been traumatizing the economy for a long time. He added that he would not withdraw his decision due to any influence by businessmen. Minister Ramesh Patirana and Presidential Secretary P.B. Jayasundara also attended the discussion.
The State Pusan Festival will take place at Mihintale in Anuradhapura this year under the theme Arogya Paramalabha. Health is the greatest wealth. This decision was taken when the Poson Committee convened under the patronage of Prime Minister Mahinda Rajapaksa at his Vijayarama official residence yesterday. At the discussion, views were put forward that the same theme of this year's Vesak festival is appropriate to be adopted for Poson as the entire world is facing a health crisis. It was also decided to observe Poson, which marks the 2328th year of the advent of Arahat Mahinda to Sri Lanka, in a manner which adheres to health guidelines so as to not hamper the measures taken by the government to control COVID-19. Thereby, the State Poson Festival at the Mihintale sacred site and religious observances conducted at the Atamasthana, such as the chanting of Satpirit and the various pujas conducted with the sponsorship of media institutions, will take place with a limited number of participants. The discussion of the Poson Committee was attended by the chief incumbent of the Mihintale Vihare, Venerable Valava Hangunavave Dhammaratna Thera, Venerable Wahantare Siddhartha Thera, Venerable Agrahare Kassapa Thera, Venerable Egoda Uyana Jnana Vimala Thera, Secretary to the Ministry of Buddha Sasana and Religious Affairs Bandula Harishchandra, Commissioner of Buddhist Religious Affairs Sunanda Karya Peruma, and a group of media organization chairpersons.
Now, lockdown has ended in all areas that were placed in isolation due to the spread of the coronavirus. The last two areas that were placed in isolation saw their lockdown ending this morning. Meanwhile, the total number of patients that have fully recovered currently stands at 477, whilst 439 patients are undergoing further treatment. The Bandaranaike Mawatha area in Colombo 12, which was placed in isolation since the 17th of April after 95 COVID-19 patients were detected, was taken out of lockdown today. Medical Officer of Health W.K. Chandrapala says 65 of these patients have recovered fully and have been discharged from hospital. The last COVID-19 infected patient was detected in this area on the 25th of last month. 1,400 persons from the area were sent to quarantine centres after the detection of COVID-19 positive patients from the area. Today, owners of trade stalls in the area were educated on carrying out their trading, adhering to health guidelines after lockdown was lifted. The Jayala Suduwella area, which was placed in isolation on the 9th of April after a COVID-19 positive person was detected on the 6th of April, was taken out of lockdown today.
As of today, we have 2,994 getting quarantined in 34 quarantine centers manned by the Sri Lanka Army, Navy and the Air Force, and especially that includes few hotels, that private hotels, but manned by the Sri Lanka Army. They have been quarantined. So far in the country, 8,847 quarantined and left to their residences, and only this 2,994 is remaining in the quarantine centers, in 34 quarantine centers. And we believe that we are planning to release the 157 today because they have finished the quarantine period, plus they have done their PCR test and found that they are negative from COVID, and they will be released. In Sri Lanka, we started quarantining people in various stages. Initially, the Sri Lankans who came from abroad, we quarantined 3,626, of which one person died of COVID, another person still getting treated in a hospital, and 3,624 left to their residences. And second stage, as and when we found COVID cases from the society, we moved them into quarantine centers. That includes certain towns or the villages where we found that their contacts are large numbers. So the certain villages were isolated. It were named as isolated towns or villages. So today, this morning, we have released the last two townships or the villages, Bandaranaike Mawatha and Suduwella, Jayala Suduwella. So these are the last two areas that we have isolated. So with this releasing of these two this morning, we are not having any towns, villages in Sri Lanka isolated. It is totally released now.
Obtaining biosamples for PCR testing from individuals from various locations in the Colombo municipality is continuously underway. Biosamples were taken from bus drivers and three-wheeler drivers in the premises of the Peta bus stand today. Biosamples were also obtained from 150 workers of the Waste Management Unit of the Galle Urban Council today. According to the report issued by the Epidemiology Unit, as at 10 a.m. this morning, within the past 24 hours, the number of fully recovered patients to be discharged from hospitals has been 32. Director General of Health Services Consultant Dr. Anil Jasinghe says the number of COVID-19 infected patients detected in the country was 10 yesterday, out of which 8 infected persons were Navy personnel, whilst the other 2 were 2 children of the infected naval persons' relatives. Jogging tracks in many areas were closed more than a month in the efforts to prevent the spread of the coronavirus. However, under the prevailing situation, these walkways have been reopened to the public upon the recommendations of the health authorities. The reopening of these walkways officially took place along the jogging tracks at Torrington with a group of police personnel of the Police Sports Division.
The Commonwealth Health Ministers' meeting was conducted through video conferencing this year. Minister of Health Pavitra Vaniarachi presented details on behalf of the Asian region at the forum, which commenced last evening. The meeting was conducted through video conferencing due to the global spread of the COVID-19 pandemic. Minister Vaniarachi presented details on the measures taken by the Commonwealth countries in Asia to combat the virus and the challenges faced by the Asian region due to the pandemic. 54 countries were part of the discussion, at which Director General of the World Health Organization Tedros Adhanom stated that such collective exchanges of views and experiences amongst countries supports the efforts to successfully face the COVID-19 pandemic.
Preparedness for a global pandemic situation should be strengthened and continuously monitored. Second, supportive activities like laboratory testing for patient care should be enhanced. Third, risk communication to the public should be a continuous process. Recommendations from the region. First, it was clearly demonstrated that the region of Asia has the safest greeting, which is done by placing the both palms together. Let me say about the Sri Lankan way of greeting by placing both palms together, saying Ayubowan, which means may you have a long life. Second, measures like hand washing is recommended to practice forever, not only during the COVID-19, but it will safeguard the personal hygiene and as well as transmission of many diseases. Third, every country to have in mind not only disaster preparedness of respective countries, but preparedness for a global pandemic. Though we never wish pandemics to happen, but wise to be prepared always. Sri Lanka, together with all the Commonwealth countries in Asia, is committed to share our experience and look forward to combat the COVID-19 at our earliest to eliminate it from the world.
Mental health experts are warning that as the world pandemic drags on, the mounting combination of death, joblessness and uncertainty is also fueling a mental health crisis. The WHO is asking governments to put the issue front and center.
Headlines about mounting death tolls and disease, fake news and political battles, people losing their jobs, economic recessions hitting across the world, people stuck indoors, and people facing it on the front lines.
We cannot take it anymore.
It's a depressing combination, of course, and the United Nations is asking governments that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many, many people. It needs to be front and center in the response, they say. Devorah Kestel is the director of the World Health Organization unit that deals with mental health, drug, and alcohol abuse.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health condition or the substance abuse, for example. Some surveys that were done in Canada, where 47% of healthcare workers reported need for psychological support. 47%, it's almost half of them. In China, we have different figures for depression, 50%, anxiety, 45%, insomnia, 34%. The numbers are there, and these are just preliminary, we know.
The WHO's report released on Thursday also shows high levels of distress in the United States' general population, about 45% of those surveyed. Children and frontline workers, they say, are among the most vulnerable groups. Reuters has itself met many doctors and nurses across the world experiencing combinations of panic, grief, nightmares. The WHO did outline steps that governments can take to help ease this burden, including addressing past underfunding of psychological services and pushing online resources such as video conferences with therapists.
Meanwhile, Japanese Prime Minister Shinzo Abe lifted a state of emergency in large parts of the country yesterday, but said it would remain in place in Tokyo until the novel coronavirus is contained.
Tokyo and Osaka are to remain in a state of emergency while the rest of Japan starts to get back to normal after Prime Minister Shinzo Abe lifted the emergency in 39 of Japan's 47 prefectures on Thursday. The world's third largest economy declared the nationwide state of emergency a month ago, urging citizens to reduce person-to-person contact by 80% to slow the spread of the virus and ease pressure on medical services across the country.
While controlling the spread of the virus as much as possible by acting on the premise that the virus is all around us, will restore ordinary work and daily life.
The 39 prefectures in which the emergency has been lifted account for 54% of Japan's population, but the Greater Tokyo area alone accounts for a third of the economy. While Japan has avoided the kind of explosive growth seen in the United States and elsewhere, its testing rate has also been among the lowest. Abe said experts will assess the situation for the areas under restriction next week.
A vaccine to counter the new coronavirus could be approved in about a year in an optimistic scenario, an agency which approves medicines for the European Union said yesterday.
A vaccine to counter the new coronavirus could be approved in about a year. That's in an optimistic scenario, an agency which approves medicines for the EU said on Thursday. The world is rushing to develop a vaccine, and the European Union, hard hit by COVID-19, fears it may not have sufficient supplies, especially if a vaccine were developed in the United States or China. The European Medicines Agency is in communication with 33 developers, and its head of vaccines, Marco Cavalieri, says it's doing all it can to speed up the approval process, but that he was sceptical of claims any could be ready by September. He ruled out the possibility of skipping the third phase of a vaccine trial, which he said was necessary to ensure a vaccine was safe and effective. The EMA is also investigating 115 different therapeutics for the coronavirus. Cavalieri said some of those treatments could be approved in Europe as early as this summer, though he did not specify which. A leading EU lawmaker has also said, should a vaccine be developed outside the bloc, that the European Union should find a way around pharmaceutical companies' intellectual property rights in an effort to make sure that the vaccine is available to all countries. A new sign of the EU's fears that they could lag behind in the global race. The US and China have so far been cautious of supporting a global funding campaign plugged by the EU, which this month raised $8 billion to research, manufacture and distribute a possible vaccine and treatments for COVID-19.
The US Food and Drug Administration voiced caution over Abbott Laboratories' widely used ID Now coronavirus test yesterday, warning that it may be unreliable despite having been approved by the FDA in late March.
The U.S. Food and Drug Administration voiced caution over a widely used coronavirus test on Thursday, saying it may be unreliable. The Abbott Laboratories test is called ID Now, and it was approved by the FDA in late March. It delivers results within minutes and is used at the White House. But the FDA said in a statement that while the test can still be used on patients, it could potentially produce inaccurate results. The U.S. regulator added that it was still reviewing data on the test and working with Abbott to find other ways to study it. Abbott has distributed nearly 2 million ID Now tests. And on Wednesday, a separate non-peer-reviewed study by New York University researchers said the ID Now tests could be missing a third to nearly half of all positive cases. And a study conducted by the Cleveland Clinic in April showed that while the test detected the virus in around 85% of cases, that was still lower than some other coronavirus tests. In its statement, the FDA said that while these studies did offer, quote, important information, it should be noted these studies have limitations, including small sample size, potential design biases, or tests that may not have been executed according to the manufacturer's instructions for use. Abbott has also criticized the studies, saying in a statement on Thursday that the number of patients tested in the NYU study was small and that the Cleveland study performed the test incorrectly. Abbott also pointed to other studies showing a much higher accuracy rate for the ID Now tests. One study done by a testing clinic in Detroit said the test was accurate 98% of the time.
And in taking a look at a few more stories from home, an evaluation discussion on the second stage of granting relief under the Ministry of Women and Children's Affairs and Social Security was held yesterday. At the discussion, it was disclosed that a 70% progress has been achieved island-wide with regard to the distribution of allowances granted to the elderly, differently abled persons and kidney patients. Minister Pavitra Wanyarachi advised the relevant sections to implement measures for the second stage of the concessionary allowances granted by the Samurdhi Department to take effect from the 18th of this month. The beneficiaries of the 5,000 rupee allowance expressed their gratitude to the President and the government as the allowance was much needed at this difficult time. The government took steps to successfully distribute the 5,000 rupee allowance throughout the country. Galle District Secretary Somaratna Vidanapatirana says the 5,000 rupee allowance has been successfully distributed among 46,530 persons in the district. 233 million rupees was set aside for this purpose. 190 million rupees was granted for 38,040 elderly persons, while 38 million rupees has been distributed among 7,600 differently abled persons. 4 million rupees has been granted on behalf of 837 kidney patients, whilst 250,000 rupees has been granted for 50 centenarian elderly persons. The 5,000 rupee allowance was delivered to the residences of 344 beneficiaries in the Valimada Divisional Secretariat zone recently. 1,720,000 rupees was allocated for this area.
Deposits to the COVID-19 Healthcare and Social Security Fund have exceeded 1 billion rupees. Sri Lanka Telecom and Mobitel have donated 50 million rupees to the fund. The cheque was handed over to President Gotabaya Rajapaksa by the company's chairman, Rohan Fernando. CEO of Mobitel, Nalin Pereira, and the board of directors were also present. The National Medicines Regulatory Authority has also donated 50 million rupees to the fund. The cheque was handed over to the President and Minister Pavitra Wanyarachi, and the heads of the National Medicines Regulatory Authority were present. NEJREP Industries has donated 10 million rupees, whilst the High Court Judges Union has donated 300,000 rupees and Tisal Kure has donated 100,000 rupees. The Association of Former Ministry Secretaries has contributed with 1 million rupees, and the Sri Lanka Podujana Engineering Front has also contributed with 1 million rupees. The Sri Lanka Football Federation has donated 2 million rupees to the fund. Bharati Airtel Lanka Private Limited donated 1.2 million rupees. Certis Lanka has also made a contribution of 1 million rupees. Richard Fernando has donated 1 million rupees and S.A. Samaratunga has donated 50,000 rupees. Donations are credited to the special account maintained at Bank of Ceylon, the account number 737373.
The Police Narcotics Bureau states the haul of 225 kilograms of heroin seized in the Valisara area at midnight yesterday has been transported to the country along the southern sea route from the boundary between Iran and Afghanistan. Upon a tip-off received by the Police Narcotics Bureau, a house along Nugagahawata Road at Valisara was raided, at which a haul of heroin weighing 225 kilos and 969 grams was discovered. The Police Narcotics Bureau states attempts to distribute the haul of narcotics island-wide under the pretext of distributing rice with the essential services label was revealed. The police also seized a luxury car and a cab used by the suspects in the smuggling racket. The arrested suspects are of the ages of 24, 30, 50 and 55 years. They are reportedly residents of Valisara and Homagama. More news from overseas coming your way after this short break. And taking a look at a few more stories from overseas, the head of the World Trade Organization has said he will step down a year earlier than planned at a crucial moment for the global economy. Roberto Azevedo's surprise departure comes as the WTO faces the impact of the coronavirus pandemic and criticism from US President Donald Trump. Global trade has slumped and the world is braced for the worst downturn since the Great Depression. Meanwhile, Mr. Trump has accused the body of treating America unfairly. Mr. Azevedo said his early departure as the WTO's Director General was a personal decision that was in the best interests of the organization. The Trump administration has repeatedly accused the global trade watchdog of having strayed from its purpose to liberalize and protect markets, and that conditions around China's entry into the organization in 2001 have led to millions of American job losses. Asked about Mr. Azevedo's exit, Mr. Trump, who had previously said the US would leave the organization if it didn't change, said he was okay with it. Mr. Azevedo's departure comes at an especially difficult time for the WTO, with global trade expected to slump to historic lows as measures to slow the spread of COVID-19 shut down economic activity around the world. At the same time, the Geneva-based body last year saw one of its main functions, arbitrating trade disputes, hobbled by the US.
The Broadway family musical Frozen is closing permanently, producers announced yesterday, the first big casualty of the shutdown in New York's theatre industry.
If you wanted to see popular Disney movie Frozen as a Broadway musical, unfortunately Elsa and her sister Anna's onstage adventures have been put on ice. On Thursday, Disney announced the show is closing permanently. Months ago, it was the first and biggest production to shut down in New York's theatre industry. Broadway went dark back in March, and the theatre closures have extended to September 6th. Live performances, especially big musicals with their large casts, will face the grave challenge of how to rework shows that respect social distancing on stage between actors and among audiences. They're expected to be among the last events to return. Frozen the musical opened in 2018 and was taking an average of about $1 million a week in ticket sales, according to box office data. The show's executive director, Mary McCall, warned of the impact on the arts sector in a statement, calling on New York's mayor, saying, quote, "Public officials at all levels must think much more boldly about supporting the arts, or our entire economy will be slower to recover." For now, fans will have to be content listening to Oscar-winning song Let It Go in their living rooms.
A quick look at the sports before we wind up. The German soccer season will resume this weekend with teams in the first and second divisions playing matches for the first time in more than 2 months. Matches will be played behind closed doors with no fans allowed inside the stadiums.
It's a sight that will bring joy to thousands of fans, not only in Germany, but across the whole of soccer. The Bundesliga is the first major league to attempt to get back playing matches for the first time since early March. But new strict guidelines, including the wearing of masks at training, are being enforced to ensure everyone's safety. One of the most visible differences will be the eerie silence inside stadiums, with no fans able to attend the games. However, through one fan initiative, more than 12,000 Borussia Mönchengladbach supporters will be there in spirit as cardboard cutouts in the crowd. When the season was paused more than 2 months ago, Bayern Munich were top of the table with 9 games of the season to go. RB Leipzig were chasing Bayern in 3rd place, and their head coach Julian Nagelsmann says the new normal is setting in for his players.
Sometimes body contact and giving a high five can be good and makes the players feel good, but the situation is what it is now and we have to act accordingly. I think most of the players are quite happy if I don't touch them.
Teams have been sent into mandatory 7-day isolation after undergoing testing in order to reduce the risk of infection. They've also picked hotels in their cities to cut travel times to training locations and airports for the weekend matches. The league intends to complete the season by June 30th.
And that's all the stories we have for you tonight. We'll see you tomorrow at the very same time. Good night.